This is Radio Health Journal. I'm Nancy Benson. This week, a theory why COVID-19 hits men much harder than young women.
The main difference is actually on severity of the disease, and that's 4 times more men than women.
Male hormones and coronavirus when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
They're being asked to do these impossible tasks, knowing that at least 1 in 4 of them is going to die.
The young Air Force pilots of World War II. Them.
They are willing to fly good spacecraft, and they are willing to fly smart missions, even if they know that by their very nature, those missions come with a high risk of death.
The heroic men of Apollo 8. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
As the COVID-19 pandemic drags on, it's become clear that it's anything but an equal opportunity infection. Some people are much more vulnerable than others. The elderly, people with chronic diseases, and people of color have been affected more often and more severely. And among people under about age 70, men are much more likely to get sick than women.
The main difference is actually on severity of the disease, who are the folks that are actually going inside the hospital because they need oxygen. And that's 4 times more men than women.
Dr. Carlos Wambier, assistant professor of dermatology at the Brown University Warren Alpert Medical School, says among younger people, men land in the ICU about 4 times as often as women due to coronavirus, and are about 4 times more likely to die. Some experts have speculated that perhaps women's estrogen provides them with some protective effect. But Wambier and colleagues writing in the journal Dermatologic Therapy propose an opposite theory, that male hormones, the androgens, provide COVID-19 with the gateway to infecting human cells.
The hypothesis, it's based on the genetics and the genetic expression of male proteins. So one male protein is very important for the virus to enter our cells. I say it's almost like if you thought of lubricating. The cells express a lot of this protein. This protease, it primes the spikes of the virus, and it also primes the superficial proteins of our cells, such as the ACE2 receptor for the virus. So by priming both, the virus can actually go inside our cells. So this protein, there is only one way for the cell to produce this protein, which is through the androgen receptor activation.
And Wambier says some men may be more vulnerable than others. If men have particularly strong male characteristics, such as a heavy beard and balding on the scalp, they're producing more androgens than other men.
It makes a lot of sense to think that the more male expression the person has, the more vulnerable the person is to a severe infection and death. The more male expression, the more the people are bald, or they have beard, or they have hair in their chest, hair in their back. Those are all male features that even inside the male population, not all men have that. That is a sign, a clinical manifestation in their skin that they have excess expression of male hormones.
Other vulnerable populations also seem to fit the theory. For example, older women. After puberty, women produce androgens only in small amounts. But after menopause, the big drop in estrogen means women begin to overexpress androgens. So by the time people reach their 70s and 80s, women and men approach parity in the number and severity of cases. But if you check female COVID-19 patients for androgen characteristics, as Wambier and his colleagues just did in a Spanish hospital, you may not find an ordinary population.
We decided to check all the patients that were admitted to a hospital, and 58% of the females, they had female pattern hair loss, which is an expression of excess hormones. So 58% is much more than the usual female population. Usually females, they have some kind of baldness ranging from 3% to 10% of the population. So in the hospital, they are over half of the females, they have hair loss. So we really think there's some interesting data there.
Wambier says the lack of cases among children also supports the theory.
Children, they don't have male hormones yet. So they don't have hair on their face. They're not bald. They don't have any expressions of male hormones. And these patients, they have very mild symptoms. And death rates below puberty are zero, are virtually non-existent from coronavirus.
In men, there's one other manifestation of the overexpression of androgen hormones, but it's a little less obvious. It's in men with an enlarged prostate, what's called BPH.
The more activity that androgen receptor expresses, the more the prostate enlarges. If a man inherits from their mother that gene, the man, they don't get this gene from their father because this gene is in the chromosome X. They inherit from their mother's side of the family the tendency to have an enlarged prostate, the tendency to be bald.
But what happens in men who take drugs to reduce an overexpression of androgens? Wambier says men may be prescribed a drug called finasteride to shrink the prostate or treat baldness. Doctors don't know yet if these men are less vulnerable to coronavirus, but they aim to find out.
We're looking for new targets, new therapeutic and also prophylaxis targets, drugs that can modify the host vulnerability. And yes, these drugs are certainly targets. We still don't know what is the risk-benefit of initiating large-scale something like that, but we're looking at people who already take those medications. We're currently doing studies all over the world looking for the whole statistics of what happens to someone who already takes finasteride for their hair, or finasteride for their prostates, or dutasteride, or spironolactone for acne, spironolactone for blood pressure. We're looking at those medications that quiet down the androgens to see if these people live more from a coronavirus infection, if they have mild symptoms.
Wambier says if men already taking the drug show a decreased vulnerability to COVID-19, then those in higher risk groups, for example, frontline healthcare workers, might be considered for its use. However, finasteride has side effects. So even if it's shown to work, reducing men's hormones may not be how we want to cut the risk of coronavirus. You can find out more about all our guests through our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
As people around the world practice sheltering in place, many are looking for ways to continue healthy habits while they're at home. The Alzheimer's Association has suggestions to benefit your body and brain during this challenging time. Here's Dr. Heather Snyder, Vice President of Medical and Scientific Relations at the Alzheimer's Association.
First, it's important to take care of your mental health. Meditation and journaling are ways to manage stress at home, and there are many online support services and resources. Second, stay connected with your friends and family through phone calls or video conferencing. Schedule a virtual game night. Third, challenge yourself with new activities that push you mentally, like reading about a new topic, learning a new language, or taking an online class.
Staying physically active, getting plenty of sleep, and eating well are also important for our brain, Snyder says.
Evidence suggests these healthy habits may reduce risk of cognitive decline as we age.
Reach the Alzheimer's Association at alz.org. or call 800-272-3900.
May is American Stroke Month, and keeping stroke in mind is more important than ever. Emergency room doctors report fewer patients coming in when they have stroke symptoms, but you should know that hospitals have reconfigured emergency care to protect patients with and from COVID-19. It's safe to call 911 and important to do it quickly. Dr. Ralph Sacco is a former president of the American Heart Association and incoming editor of the Stroke Journal.
Every minute counts if someone is having a stroke. Clotbusters can reduce disability if administered within hours. That's why the American Heart Association, the American Stroke Association, issued emergency guidance to stroke centers, recommending increased use of video conferencing with EMS to ensure that suspected stroke patients are taken to the right hospital immediately.
Learn the acronym FAST for key stroke symptoms. F for face drooping, A for arm weakness, S for slurred speech, and then T, time to call 911. Find out more at stroke.org.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
The very act of singing might be right up there with skydiving in terms of one's safety during this epidemic.
Why your church choir or local chorus may be one of the last things to come back from the pandemic.
Then why women are genetically stronger than men.
It's not just having an extra pair chromosome, like a backup chromosome, like a spare tire in your trunk that you pull out if you have a flat, and they share and cooperate.
All that and more on Radio Health Journal.